Greetings, everyone. Good to see you again. This is Unit 9, which correlates with Chapter 19 in your textbook, where we're going to talk about principles of surgery. Coming off a rather long unit, this one will be quite a bit more brief. Just wanted to touch on some basic topics of surgery. Not that, unless some of you end up for sure becoming veterinarians, the rest of you may not ever necessarily have to perform some of these skills, but it's good to know how to go about it, and then maybe more importantly, how to evaluate your veterinarian's work if they have to perform surgery for you. So it is good to know the steps and the key things that are important, and if you can build a little bit of skill yourself if you needed to perform a little bit of an emergency surgery or suture in order to just simply attempt to keep an animal alive, you could accomplish that. So let's get into our content here. So just some basic principles as we go through the first few slides. And first and foremost, I highly recommend that you practice aseptic technique. The skin and the mucus that the body naturally has, provides a natural barrier to interfere with pathogens. And so anytime that you disrupt that barrier, you run the risk of introducing bacterial infections into your animal that you'll, of course, then have to deal with that way as well. So aseptic technique minimizes that risk for infection. So you'll need to sterilize your equipment. That can be done in an autoclave like what you see here in the picture. That's the best way to do it. It's very, very high temperature with moisture, cooked essentially quickly over a period of time. And then all that stainless steel equipment then is quite sterile. It can be packaged and transported to the farm or to the surgical room without worry about it becoming compromised. Then, of course, use a disinfectant. Things like iodine scrubs utilized on the body surface is really, really important to help practice aseptic technique. Furthermore, your veterinarian, or you should use latex gloves and maybe even double glove, potentially even a gown, in order to just minimize the transfer of bacterial risk. And it all depends upon the veterinarian and the site or location that they're going to perform surgery as to what is really appropriate. A few of the things you see, a picture here of the potential surgical instruments, and these are just a few, just to give you an example of what you might be dealing with or what your veterinarian might have in his toolbox, so to speak, in terms of surgical instruments. I'm not going to go through them in particular because this is a rather brief list, but just some basic things. Again, it would probably be wise if you are a livestock owner to have a few of these things on the farm on your own, just in case you needed to deliver something, do a little bit of surgical procedure, simply again to save an animal's life. Some basic principles in terms of the animal preparation. Generally speaking, hair should be clipped basically with a surgical blade. That's about a 50 blade typically, in order to completely clean that area. Hair tends to retain particles and dirt and bacteria that could compromise the field of surgery. So you definitely want to clip that off and get it clean, scrubbed. Use an iodine scrub as you see here with this dog that's undergoing surgery. Get that particularly clean. Some of this is going to sound very, very straightforward and quite logical, but I've personally worked with veterinarians, and some of them have great varying preferences on how much sanitation they prefer. For example, I worked on a dairy at one point in time that one veterinarian preferred gowning, double gloving, a very large clipped field if they were going to perform surgery on a cow. She would go through 2 or 3 steps of iodine scrubs and really cleanse the area, sometimes even throw a drape over the top of it depending on the cow and the conditions. Extremely clean in terms of her equipment and the platform that they sat on, and she was very successful. She was a great surgeon on cattle. Consequently, we also had another individual on that farm that would come in and he was not worried about clipping. He threw all of his equipment in a bucket of iodine and did the surgery bare hands. And clearly there would be a difference in success rate. So not all veterinarians actually perform surgery exactly the same way. Okay, so we've gone through, let's say, a surgical process, and it's important when planning it to understand how a laceration is going to heal, because you're now creating, of course, a laceration. And so the process, as indicated by the arrow, you're going to start with the homeostasis phase, where bleeding is natural to occur, flushing the wound, which is, of course, going to lead to a scab. You've then got the inflammation phase. And WBC in this slide is white blood cells. They're going to aid in fighting off any kind of infection. The blood vessels are going to be dilated, so you're going to have some swelling in the surgical area or that laceration area as it works on beginning to mend. Next comes the proliferation phase. So you have connective tissue now that starts to knit the wound back together, and we start to see capillary regrowth into new tissue. And then finally, and hopefully, a remodeling phase where the tissues and the blood are now completely restored, the wound is essentially healed, and the animal begins to have no issue at all whatsoever with that particular wound at any time. And if your veterinarian has done a great job of performing surgery, has a nice, clean laceration, has done a great job suturing up the laceration, it should heal with no trouble. So there's a couple different subsets of laceration healing. The wound edges should be closely opposed to one another. They should be right next to each other. And that really critical period is the first 6 to 8 hours. Hopefully bacterial numbers are very moderate. That's why it's so important that your laceration site, the surgical site, is so clean. Because that first 6 to 8 hours is so essential in making sure that we can begin to knit that together really quickly. And some think it takes a lot longer than that critical period. That nothing is really going on for that first 6 to 8 hours. But in fact, that's maybe the most important part. Second intention healing is effectively healing large wounds. And sometimes you get the introduction of proud flesh. Proud flesh is flesh that grows, kind of gets out of control, so to speak, in healing a laceration, and you'll have to sometimes remove that because that's the additional flesh that you don't need. Again, cannot stress this enough. Practice asepsis. Really work on keeping your field clean, your equipment clean, your hands clean. Handle the tissue that you're working with during surgery very carefully, good soft hands. Try not to disrupt any blood supply. Major blood supplies with incisions, so understanding anatomy is really critical. And then whenever suturing it back together, hopefully we're preventing dead space, because that will harbor bacteria as well. Leave sometimes a spot for the suture to drain, so that it will kind of continue to flush itself out and not heal over and then lock some of that disease-causing bacteria in. Moving on, again, talk a little bit about sutures and suture options. Of course, you have the absorbable and non-absorbable options. So whenever you're suturing inside an animal that you can't go in and remove it, you'll, of course, need to use an absorbable type of suture. And then surface lacerations, oftentimes they will use a non-absorbable type of suture. And dehiscence is the breaking of the wound edges. And so you want to keep that tightly knitted together, but not so tight that it pulls the skin too tight together. So along the suture line is really critical, that space or gap that you leave. On occasion, we need to use an endoscope to kind of view on a monitor, be less invasive, to figure out what's going on inside, and that can be controlled from outside the body, just basically a scope that you would send inside through a tube or through a laceration that you could maybe examine the interior of a small intestine or something of that nature. Again, less invasive than conventional surgery types, but only appropriate at certain times. Then we, of course, have to think about how do we deal with recumbent patients or patients that, animals that can't rise themselves and exercise. So on occasion, you may need to place some additional padding under an animal to prevent them from getting what would essentially be a bed sore. Or like a cow, you would need to roll them from side to side because we need to keep the circulation going. We need to keep the muscles functioning. They undergo atrophy if we don't get them exercising as quickly as what we can. And of course, then if we need to provide supplemental warmth, use blankets or something like that in order to help support body temperature. On the slide here, there is a number of different suture patterns that may be appropriate dependent upon the laceration or the type of surgery being performed. Veterinarians in the large animal livestock use the forward interlocking pattern a lot. And there are more than these available, but a lot of it just depends on the type of surgery performed and what would be appropriate for the laceration that you're trying to mend. Some common considerations as we get towards the end of this rather short section is there's really not just, again, one given type of surgery or even surgical protocol. It may really depend upon what you're dealing with, the different tactical steps that you might have to take in order to perform a successful surgery. And again, some veterinarians have a particular method that they like at certain times, and so they have very particular steps. So it will be very carefully planned out how you're going to go through the surgery. So summarizing this, again, just a single episode in this section. Again, it requires great technique and a lot of practice. Most of us lay people just aren't very good at doing something like this, and nor do we necessarily understand the anatomy and physiology effects on the animal that we need to be aware of. So make sure that you are working with a well-trained and excellent veterinarian if you need to perform surgery. Post-surgical wound care is probably on you, though. That's essential that you understand how to do it, how to support that animal so that that wound will heal appropriately and either not leave any scar or minimize the scar. And then, I really, again, cannot stress enough aseptic technique, sanitary equipment and environment. And in this part, I would say evaluate your veterinarian carefully. It would be very clear if they take that as serious as they should, and it seems that would be logical. But again, I've witnessed veterinarians that some of them are very particular on their aseptic technique and their strategy for surgery and the environment that they will or will not perform surgery in. And I've seen others that just don't think it's that big of a deal. And sometimes the outcomes are quite drastic between the two. So I appreciate you tuning into this section. Hopefully you'll be successful in the assessments that are associated with it. And as always, if you need assistance, please shoot me questions or reach out for help. I'm glad to help you. Have a great day.